friends, hello friends, let us now learn some important points about astrocytoma. Astrocytoma, as the name says, it arises from astrocytes. This is the most common actually sorry this is a supratentorial tumor which is seen in adults and children. Sorry, one thing, astrocytoma is actually a supratentorial tumor, especially in adults, where it mainly involves the cerebral cortex, whereas if you see in the children, it is primarily an infratentorial tumor which in children, where this astrocytoma mainly involves the cerebellum in children. So most common type of astrocytoma in children, if you see, it is a low grade type which is called as pilocytic astrocytoma. Most common type of astrocytoma in adult is a high grade astrocytoma which includes glioblastoma multiforme, and this is the most malignant lesion, which is glioblastoma multiforme. Then if you see the pathology, in the pathology we will see that there are infiltrates which are surrounding the brain. So here the histological features of this high grade tumors, histological features mainly include presence of hypercellularity, there will be nuclear atypia is seen, and you will also see presence of endovascular hyperplasia is seen in the patients. Okay, then the unique feature of glioblastoma multiforme, if you see, this is necrosis is the unique feature of glioblastoma multiforme. Then WHO classification of astrocytoma is very important. Okay, according to the WHO classification, astrocytomas are divided into 4 grades. Grade 1 includes, we have pilocytic astrocytoma. This pilocytic astrocytoma is the most common astrocytoma which is seen in children. It does not infiltrate the brain. It is often a cystic lesion with mural nodule is seen in grade 1 or pilocytic astrocytoma. Treatment is here, we can do radical resection can be done. So this is about grade 1 or pilocytic astrocytoma. Then we have the next grade, which is grade 2 or low grade astrocytoma. This low grade astrocytoma occurs in children and it is also occurs in young adults. And here this low grade astrocytoma is associated with seizures. Treatment is, you will see radiotherapy with chemotherapy, and you can also do surgery can be done in these patients. Then we have grade 3. Grade 3 is includes anaplastic astrocytoma. Here you will see, because it is anaplastic, you will see presence of irregular enhancement on the MRI. And treatment here is, you will have, because it is a little advanced tumor or complicated tumor, here you should do cytoreduction surgery should be done, followed by external beam radiotherapy is given to the patients. And in grade 4 astrocytoma, which includes glioblastoma multiforme, this is actually the most common type which you see in adults, and this is most malignant. Because it is most malignant, it has worst prognosis is seen. Then if you see, one more important thing is, this glioblastoma multiforme is associated with endothelial proliferation, and you will also see necrosis. Okay, here if you see, this looks something like this. I would like to draw the MRI picture. So if this is the brain, you will see in the almost this develops in the left. See, this is the midline. So I will draw the midline here. right? This is the midline. Here the tumor is started to develop here, and it will almost cross the midline and it will go to the other side. So here you will see presence of ring like enhancement is seen in the tumor surrounding. The wall is very thickened. This will be white in color or bright in color with thick enhancement. Okay, so this tumor has so this central black one which I have drawn is central necrosis, and this is surrounded by the this one which is ring shaped ring like enhancement, right? And if you see, it is a dangerous tumor because it can cross the midline. And if you see, doesn't it look like a butterfly? So it is called as butterfly tumor. So what do you have? Butterfly tumor. So what do you do in this grade 4 glioblastoma multiforme? Treatment is, even here you should do a cytoreductive surgery is done, followed by external beam radiotherapy. In malignant glioma, the most common chemotherapeutic drugs which we can use is, we have two types. One, carmustine can be used, and we can also use cisplatin in the treatment of astrocytoma or malignant glioma. Then even nowadays new agents have been used for newly diagnosed glioblastoma multiforme, and for recurrent glioblastoma multiforme we started using one more drug which is temozolomide. So this is about the astrocytoma. Thank you for watching.